The Senate budget also bans flavored tobacco and vaping products except for menthol. Dolan said that's the approach he thinks will help stop smoking and keep kids from starting, rather than smoking cessation programs. Ohio has the fourth highest smoking rate in the nation, according to the CDC. And anti-smoking advocates are frustrated that the Senate cut the $14.7 million for those smoking cessation programs.
The state receives about $1.2 billion per year from tobacco settlement money and tobacco taxes. And so we're only asking them to, well, the governor proposed $20 million for this line item per year, and that's what we supported. So that's what we were asking them initially. Now, obviously, the Senate has cut that significantly, right? And so we're trying to get that back up.
I can imagine that there are people who say, hey, I don't smoke. Why should I pay to help people stop smoking? As a taxpayer, why is this my problem?
That's a really good question. And, we have heard that quite a bit. So, the biggest concern that everyone should have, whether they smoke or not, is that smoking is estimated to cost Ohio about $6.56 billion in direct healthcare costs per year. And $1.85 billion of that comes from Medicaid, which is obviously taxpayer money. And so what we see in Ohio on an annual average is that residents pay over $1,100 per household in state and federal taxes, whether they smoke or not.